Welcome to MCQs Hub YouTube channel. Today video is most important MCQs from Midwifery MCQs. 1. When monitoring the progress of labor, the midwife can indicate good progress of labor in active phase when the cervix dilates at a rate of 2 cm per hour. B. Cervical dilatation falls on or to the left of the alert line together with improvement in the station of the presenting part as assessed on vaginal examination. C. Cervical dilatation falls on or to the left of the alert line together with less fetal head palpable above the pelvis. D. There's progressive dilatation and effacement of the cervix. Correct option is D. There's progressive dilatation and effacement of the cervix. 2. A 31-year-old multipra is admitted to the birthing room after initial examination reveals her cervix to be at 8 cm, completely effaced, 100%, and at 0 station. What phase of labor is she in? A. Active phase. B. Latent phase. C. Transitional phase. D. Expulsive phase. Correct option is A. Active phase. 3. Which of the following is typical of a show? A. A vaginal bleed that soaks a sanitary towel. B. A slight bleed consisting of blood mixed with mucus. C. A vaginal discharge mixed with blood. D. Contact bleeding from the cervix caused by speculum examination. Correct option is B. A slight bleed consisting of blood mixed with mucus. 4. Which of the following characteristics of contractions would the nurse expect to find in a client experiencing true labor? A. Occurring at irregular intervals. B. Starting mainly in the abdomen. C. Gradually increasing intervals. D. Increasing intensity with walking. Correct option is D. Increasing intensity with walking. 5. A patient is in the second stage of labor. During this stage, how frequently should the nurse in charge assess her uterine contractions? A. Every 5 minutes. B. Every 15 minutes. C. Every 30 minutes. D. Every 60 minutes. Correct option is A. Every 5 minutes. 6. What is the normal baseline fetal heart rate in labor? A. 100 to 120 beats per minute. B. 120 to 140 beats per minute. C. 140 to 160 beats per minute. D. 110 to 160 beats per minute. Correct option is D. 110 to 160 beats per minute. 7. A patient presents in labor at term with 2 contractions of 35 seconds each every 10 minutes. The cervix is 3 cm dilated and the membranes are bulging. After 4 hours the cervix is 4 cm dilated while the other observations are unchanged. What is the correct management? A. An oxytocin infusion should be started. B. A caesarean section should be done. C. The patient's membranes should be ruptured. D. The doctor should be called to examine the patient. Correct option is D. The doctor should be called to examine the patient. 8. The multigravida mother who is in active labor calls out to the nurse, "The baby is coming." Which of the following would the nurse do first? A. Inspect the perineum. B. Time the contractions. C. Auscultate the fetal heart rate. D. Contact the birth attendant. Correct option is A. Inspect the perineum. 9. The midwife knows that birth is imminent when A. Anus gapes and perineum bulge with an increase in bloody show. B. Perineum retracts and there is increase in meconium stained fluid. C. Perineum retracts with increase in bloody show. D. Woman has rapid intense contractions. Correct option is A. Anus gapes and perineum bulge with an increase in bloody show. 10. All the following are signs of obstructed labor except A. Retraction ring. B. Non-engagement of the head despite good contractions. C. Dehydration. D. Rapid dilation of the cervix. Correct option is D. Rapid dilation of the cervix. 11. Which of the following factors will place a patient at the highest risk of abruptio placentae? A. A history of abruptio placentae in a previous pregnancy. B. Any of the hypertensive disorders of pregnancy. C. Intrauterine growth retardation. D. Cigarette smoking. Correct option is A. A history of abruptio placentae in a previous pregnancy. 12. How often should the blood pressure be monitored in a low-risk patient during the latent phase of labor? A. Every 15 minutes. B. Every 30 minutes. C. Hourly. D. Every 2 hours. Correct option is C. Hourly. 13. The commonest cause of a reduced supply of oxygen to the fetus during labor is A. Uterine contractions. B. Partial placental separation. C. Placental insufficiency. D. Infection of the membranes. Correct option is A. Uterine contractions. 14. Meconium staining of the liquor is commonest in A. Patients in postterm labor. B. Patients in term labor. C. Patients in preterm labor. D. Patients whose fetuses move a lot during pregnancy. Correct option is A. Patients in postterm labor. 15. Pain relief in labor should be given. A. When a patient's cervix is 4 to 6 centimeters dilated. B. When a patient is having 3 strong contractions in 10 minutes. C. When a patient reaches the active phase of the first stage of labor. D. When a patient asks for pain relief. Correct option is D. When a patient asks for pain relief. 16. When in labor, a diagnosis of occipito-posterior presentation is made. The most appropriate management would be A. Emergency caesarean section. B. Continue monitoring the woman for progress of labor. C. Early rupture of membranes. D. Start oxytocin drip. Correct option is B. Continue monitoring the woman for progress of labor. 17. The nurse determines that fetal distress is occurring after noting which of the following signs? A. Moderate amount of bloody show. B. Pink-tinged amniotic fluid. C. Meconium-stained amniotic fluid. D. Deceleration of fetal heart rate with each contraction. Correct option is D. Deceleration of fetal heart rate with each contraction. 18. When teaching umbilical cord care to a new mother, which information would you include? A. Apply surgical spirit to the cord with each diaper change. B. Cover the cord with petroleum jelly after bathing. C. Keep the cord dry and open to air. D. Wash the cord with soap and water each day during a tub bath. Correct option is C. Keep the cord dry and open to air. Thanks for watching. Now subscribe MCQS Hub.